on vacation in Del Mar, California, and I tore my rotator cuff about a month earlier. And I knew I didn't want to have surgery because I was about to enter into another college football season, and I didn't want to be in the studio with a sling on my arm. And so I was just searching, and I located her. They're on vacation, called up, made an appointment, and the rest is history. I came in and we inquired about the PRP, platelet-rich plasma therapy, and I said, this is what I want to embark on because I will not have to be in a sling other than for a couple of days, and it was prior to football season commencing, so the timing was great, and the procedure, it was something outside the box as far as I was concerned. I understand it's been around for a while, but I wasn't aware of it to the extent that I am now, and so I'm glad I chose that procedure as opposed to having surgery.
When I met Brian, he complained of shoulder pain and knee pain. As an ex-NFL player, his body took a bit of a beating. When I saw him, he was suffering from his second rotator cuff tear and a meniscal tear in his knee. He did not want surgery, so he came to me asking for non-surgical treatments. So with Brian, I did a platelet-rich plasma injection in his shoulder, which is a procedure where we take one's own blood, we concentrate the platelets, which are rich in growth factors, and we inject it into the target tissue. So I did that with Brian, combined with an exercise program, and sure enough, he did very well.
My shoulder feels great. It actually feels better than the healthy one. So I'm glad I chose PRP as opposed to your regular garden variety surgery, and I'm glad I chose Dr. Carter.
With Brian's knee, with an extensive meniscal tear and a bit of arthritis, I decided to do a stem cell procedure. We took a bit of bone marrow aspirate and we injected the bone marrow aspirate into his knee, and within a few months he was able to return to his active lifestyle.
As far as my knee, I had a torn meniscus and could have gone the old surgical route, but chose an alternative, which was the stem cell procedure. Dr. Carter recommended that, and I said, cool, I'm down with alternative methods, and so glad I chose that procedure as I did choosing the PRP for my shoulder, and within weeks my knee was feeling 100% better. It still feels great. What was cool about Dr. Carter was that she was so down to earth, so personable and disarming. And she walked me through the entire procedure, much like a coach walks you through a game plan, a particular scheme, and it was a friendly environment. Everyone in the office that I encountered, they were down to earth and very personable, and so you tend to gravitate to people like that. So that made the experience, although I was in a ton of pain, it made it a little bit more enjoyable knowing I was around people that actually cared about my well-being and were so friendly.